The People's Pharmacy podcast is supported in part by CocoVia Memory Plus. CocoVia cocoflavanols support both cardiovascular health and cognitive function by promoting healthy blood flow, transporting oxygen and nutrients to vital organs and muscles, including your heart and brain.
CocoVia Memory Plus has 750 milligrams of cocoflavanols, the plant-based nutrients from fresh cocoa that have been proven to help boost memory.
CocoVia Memory Plus is backed by 4 clinical trials that demonstrate improvement in 3 different aspects of memory: long-term memory, spatial memory, and word recall. The studies show improved brain function in just 8 weeks.
You can try the benefits of CocoVia Memory Plus with a 25% discount off your first month. Use the code PEOPLES25. To get the full benefits, take it daily for 8 weeks. CocoVia is offering People's Pharmacy podcast listeners a 10% discount on subscriptions. That code is PEOPLES10. Learn more at cocovia.com. How do you catch COVID-19? This virus is highly contagious. We'll talk with 2 experts about airborne viral transmission. This is the People's Pharmacy with Terry and Joe Graydon.
There's been tremendous scientific controversy about whether this virus mainly spreads through droplets, or if it can also travel substantial distances through the air as an aerosol.
Dr. Lindsay Marr and Dr. Richard Corsi are among a handful of engineers who study indoor air pollution and viral transmission. What do they recommend to help you protect yourself from COVID-19?
Are there ways to improve ventilation and air filtration so that being indoors will be less risky?
Coming up on the People's Pharmacy, what you need to know about airborne coronavirus.
In the People's Pharmacy Health Headlines, the mysterious halt of the Oxford University AstraZeneca COVID-19 vaccine trial has caused concern. The vaccine, termed AZD1222, is part of Operation Warp Speed. The U.S. government has committed $1.2 billion for 300 million doses of this vaccine as soon as it proves safe and effective, so there's a lot riding on the trial. One British volunteer in this trial suffered a serious adverse reaction called transverse myelitis. In this condition, the myelin sheath surrounding nerves becomes inflamed. Although the cause is uncertain, it can be triggered by viral infections or vaccination. British regulators are now satisfied that the safety review has been completed, and they've allowed the clinical trial to resume. In the U.S., however, the National Institutes of Health are still investigating, and FDA has not yet given the green light for the trial to recommence.
Dining in restaurants can increase your risk for catching COVID-19. That's what the CDC found after analyzing data from people who tested positive for SARS-CoV-2. There were 314 people in the study. 154 had tested positive during July. The other 160 were negative for the virus. The CDC interviewed everyone about their community activities such as shopping, going to the office, attending church services, using public transportation, eating out, or going to a bar. People who tested positive were twice as likely to have eaten at a restaurant during the 2 weeks before they got sick. Equal numbers in both groups used some sort of facial covering, and about the same number in each group visited someone or went shopping. Going to bars, coffee shops, or restaurants appears to increase the risk for catching COVID-19 because it's impossible to eat or drink while wearing a mask.
A wedding and reception in Millinocket, Maine has resulted in more than 175 cases of COVID-19. 7 people have died. None of the people who died actually attended the reception, demonstrating just how broadly this infection can spread. 65 people were present to help the newlyweds celebrate, and 56 caught SARS-CoV-2. The attendees went on to spread the infection to a nursing home, a jail, and a church more than 200 miles away. This offers a clear lesson that the coronavirus causing COVID-19 is easy to catch and transmit.
High blood pressure is one of the pre-existing conditions that make people more vulnerable to complications from COVID-19. Unfortunately, an increasing proportion of Americans now have uncontrolled hypertension, according to an analysis published in JAMA. The data on more than 18,000 patients with high blood pressure were collected through the National Health and Nutrition Examination Survey in 2013 and 2014, and again in 2017 and 2018. The investigators considered that blood pressure was under control if the top number was under 140 and the bottom number was under 90.
In 2013-14, 54% of people with high blood pressure had it under control. 4 years later, that rate had dropped to 44%. People who had a primary care provider were more likely to have their blood pressure controlled. Current guidelines set the limits of controlled blood pressure at 130/80. Applying that more stringent criteria means even fewer people actually have their blood pressure where it should be. The authors recommend that people monitor their blood pressure at home and adopt non-drug approaches such as exercise and diet in addition to taking medication.
The Annals of Internal Medicine is a highly respected medical journal that's been publishing for nearly 100 years. It represents the pinnacle of mainstream medicine. That's why it's especially intriguing to read an article in this week's journal about the use of the Indian spice turmeric for symptoms of knee arthritis. The Australian researchers carried out a randomized, double-blind, placebo-controlled trial using an extract of turmeric. Over the course of 3 months, 70 volunteers took 2 capsules daily of extract or look-alike placebo. By the end of the study, people taking turmeric reported less pain and stiffness. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. How does the coronavirus spread? Scientists have been debating this question from the earliest days of the pandemic.
2 months ago, more than 200 scientists sent a letter to the World Health Organization urging it to consider strong evidence that the SARS-CoV-2 virus that causes COVID-19 can be transmitted through tiny aerosol particles as well as through larger droplets. Both of our guest experts today signed that important letter. What is the difference between the various types of virus-carrying particles, and why does it matter?
Later in the show, we'll talk with Dr. Lindsay Marr. She's one of the world's foremost authorities on airborne viral transmission. First, though, we turn to Dr. Richard Corsi. He's Dean of the Massey College of Engineering and Computer Science at Portland State University in Oregon. Prior to his current position, Dr. Corsi spent 25 years as a faculty member, department chair, and endowed research chair at the University of Texas at Austin. There, he did extensive research related to sources, human exposure to, and control of a wide range of indoor air pollutants. He is currently the president of the Academy of Fellows of the International Society of Indoor Air Quality and Research.
Welcome to the People's Pharmacy, Dr. Richard Corsi.
Thank you for having me.
Dr. Corsi, you are an expert in air. You study ventilation systems, you study how things move through the air, you study how things can disinfect particles in the air. And I guess I'd like to start with a question about the World Health Organization and the Centers for Disease Control. In the early days of the pandemic, it was thought that all we had to worry about were droplets. You know, like if you were a couple of inches away from somebody and they sneezed in your face, you're kind of in trouble because you got a lot of big droplets now all over you. But you've been suggesting that, well, wait a minute, it's not just droplets, it's airborne aerosols. Can you explain the difference between droplets and aerosols and why you think WHO was a little slow when this issue really started to surface?
Yeah, it's a great question. You know, there are 4 primary transmission mechanisms. One is direct contact, where you touch somebody or you touch their hand and then you touch your mouth. Another one is fomites, contaminated surfaces that you touch, and then you touch your mouth, your eyes. The third is close contact, which can involve large droplets, particles that are very large, but can also involve a concentrated stream of much smaller particles when you're speaking with somebody that you're inhaling. And then the fourth is what I call the far field, aerosols that essentially can accumulate in the indoor environment. And even people that aren't in close contact with an infector can breathe. It was very frustrating to a number of us that at the very start of the pandemic that one of those four transmission mechanisms was downplayed, effectively dropped by both the World Health Organization and the Centers for Disease Control. And there were, half a dozen of us that were saying, wait a minute. Particles that come out of the mouths of or noses of infectors take a wide range of particle sizes, have a wide range of particle sizes. There's a 1,000-fold difference in the size of those particles. Particles that can be as much as 100 to 200 microns that are the cross-section of a human hair, essentially, that we can actually see when spittle comes out of somebody's mouth when you're talking to them, right? That's the larger size particles. Those are what we call droplets, or people refer to as droplets, that can settle very close to where the infector is emitting those droplets. And that can get in somebody's face if they're close to an infector. But at the other end of the spectrum, 1,000 times smaller particles, which tend to, on a number basis, be hundreds to thousands of times more in terms of just numbers of particles, they can stay suspended in air. And even when you're close to a person, you can breathe those tiny particles as well. And they can stay suspended in air, so people that aren't even in close contact with the infector can breathe them from 25, 30 feet away, maybe even in another room.
Dr. Corsi, what were you seeing that made you convinced that the WHO and other organizations really should be paying more attention to this potential of very small aerosolized particles?
Another great question. So early on, I think the main concern is, why did we drop this one transmission pathway without ever having any proof that it wasn't? We sort of didn't follow the precautionary principle for that one of four transmission mechanisms, pathways. By March, it became increasingly evident because of some outbreaks that occurred that just looked like they were airborne pathways, far field aerosols, tiny particles away from an infector. The evidence just started piling up. And then around mid-March, there was a paper published in the New England Journal of Medicine that was very good really systematic experimental research that showed that the SARS-CoV-2 virus, this coronavirus, actually had a pretty long half-life in particles, even small particles, when airborne. That was a big red flag at that point that said, aerosols look like they're really important. We've got increasing circumstantial evidence from outbreaks occurring in China and even in the United States, in the Northwest, in Skagit, for example, Skagit, Washington. And now we've got this evidence from research that's been published in a great journal that says the virus can survive, and it can survive with half-lives, meaning at least 50% survival of the virus, for times that are longer than air typically stays in most buildings.
Now, Dr. Corsi, a lot of people said, well, that's experimental. That's not the real world. And here we are many weeks later, and we actually have a number of real world, I'm going to call them experiments, but they were sort of accidental. One was in a nursing home in the Netherlands where there were about, I think, 6 different wards. And one of those wards had a very energy efficient ventilation system. They only turned on the outside air input when the CO2 levels, the carbon dioxide levels, were really high. And in that particular ward, I think 80% of the folks, the patients in that ward came down with COVID-19. And about half of the staff did because they weren't getting good fresh air ventilation. The other 5 wards had the old-fashioned non-energy efficient system, and nobody came down with COVID-19. So that was one example published. I think, Terry, wasn't that the JAMA of JAMA Internal Medicine? You don't remember?
I don't recall.
Okay. So I think that was in JAMA Internal Medicine. Then there were a couple of other interesting articles. One, I think, was in Clinical Infectious Diseases. It was about a bus in China. Mm-hmm. Early on, people were going to what was the name of the city, Terry?
Ningbo.
And one person on one bus, this was for a Buddhist retreat, one person was sick, and I think it was, 30 people came down with COVID-19 on that bus. The other bus, nobody came down with it because there was nobody to spread it, even though the people did have lunch together and worship together when they got to Ningbo. But the implication was that if you're on a bus and somebody's sick, a lot of people can come down with it. And then finally...
And by the way, that was before this person was coughing or sneezing.
Right, asymptomatic. And then finally, we've got Millinocket, Maine, a wedding at the Big Moose Inn. And at last count, over 140 people have become infected as a result of this wedding in the Big Moose Inn. So tell us a little bit about the spread of the virus in places where maybe ventilation isn't so great.
Yeah, so good ventilation, making the indoor environment as close to the outdoor environment as you can. That's impossible, but basically bringing more of the outdoor in is pretty critical, right? The bus example you gave, for example, if you just keep the windows open on the bus, there will be so much ventilation that sort of background aerosols and inhalation of background aerosols will not be a problem. The only problem would be in a case like that if you're sitting next to an infector or sitting right in front of an infector. So close contact becomes important when you have good ventilation. And the far field, sort of away from an infector, inhaling the aerosols that they emit that are virus laden, is not as important if you have proper ventilation. In some cases, it's hard to increase ventilation. So I'm in Portland, Oregon. At our university, the outdoor air supply rate to classrooms is already very high. So it's hard for us to get higher. But in some places, and principally for energy conservation reasons, that ventilation, bringing in outdoor air supply rate tends to be very, very low. You alluded to the fact of sort of new energy efficient ventilation system. This is an issue that we've had in the indoor air quality field now for a couple of decades. The move to conserve energy sometimes conflicts with the healthiness of the indoor environment. And now we're seeing it sort of in an extreme case here with COVID-19. If ventilation is the only removal mechanism for the aerosols, in other words, you don't have a centralized air filtration system with good filters in it, or you don't have portable air cleaners, if ventilation is the only mechanism for removing aerosols from the indoor environment, tiny particles from indoor air, then you have essentially an inverse linear relationship. So if you double the amount of outdoor air that you bring in, you'll 1/2 the amount of aerosols in the air. If you have other removal mechanisms such as filtration, those types of things, then portable air cleaners, then ventilation has to compete against those. So if you double the ventilation rate, you're not going to half the amount of aerosols in the air. You might reduce it by 30 or 40%. So ventilation plays a key role. And that's why we also say, the ultimate ventilation is go outside and do your activities outside, whether you're teaching a class or whether you're having a wedding or, whatever it is you can do outside, eating outside, do it outside, because there you have essentially infinite ventilation.
You're listening to Dr. Richard Corsi, Dean of the Massey College of Engineering and Computer Science at Portland State University in Oregon. He's currently president of the Academy of Fellows of the International Society of Indoor Air Quality and Research.
After the break, find out how particle size affects what happens to those particles indoors.
You'll hear about different strategies you can use to reduce your risk of indoor exposure to SARS-CoV-2.
Do energy-efficient HVAC systems recirculate more virus?
An ideal ventilation system for the 21st century would minimize exposure to infectious pathogens. What would it look like?
Dr. Corsi will offer his recommendations for air filters and air cleaners.
You're listening to The People's Pharmacy with Joe and Terry Graydon. The People's Pharmacy podcast is supported in part by CocoVia Memory Plus. Cocovia cocoflavanols support both cardiovascular health and cognitive function by promoting healthy blood flow, transporting oxygen and nutrients to vital organs and muscles, including your heart and brain.
Cocovia Memory Plus has 750 milligrams of cocoflavanols, the plant-based nutrients from fresh cocoa that have been proven to help boost memory.
Cocovia Memory Plus is backed by 4 clinical trials that demonstrate improvement in 3 different aspects of memory: long-term memory, spatial memory, and word recall. The studies show improved brain function in just 8 weeks.
You can try the benefits of Cocovia Memory Plus with a 25% discount off your first month. Use the code PEOPLES25. To get the full benefits, take it daily for 8 weeks. Cocovia is offering People's Pharmacy podcast listeners a 10% discount on subscriptions. That code is PEOPLES10. Learn more at cocovia.com.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by Cocovia Memory Plus, a cocoflavanol supplement backed by 4 clinical studies that show significant improvement in 3 different aspects of memory. More information at cocovia.com.
Also by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
Prior to the pandemic, most of us didn't pay much attention to ventilation. Now, though, air circulation has become a matter of life and breath. How can you reduce your chances of catching COVID-19 indoors?
Our guest is Dr. Richard Corsi, Dean of the Massey College of Engineering and Computer Science at Portland State University in Oregon. He's currently the president of the Academy of Fellows of the International Society of Indoor Air Quality and Research.
Now, Dr. Corsi, you have just described that there is a big range of particle sizes that people can emit, and any of these particles presumably could be carrying virus. How does the particle size affect what happens to these particles when they're indoors?
It's a great question. So the particles that are more than about 50 microns, once they start getting larger than 50 microns, they settle out by gravitational settling to the floor and other surfaces relatively quickly, on the order of seconds to tens of seconds. Once you get below 10 microns, particles tend to stay suspended in air for pretty long times and pretty long distances. Even a 10 micron particle can travel at typical indoor air speeds about 25 meters before it settles by gravitational settling. And early on in the pandemic, there was a lot being written about anything over 5 microns deposits quickly on the floor. That's simply not true. And many of us knew that wasn't true, and we were trying to get the word out that wasn't true. 5 micron particles are going to stay suspended indoors for as long as the air is indoors. So these larger particles or droplets that are more than about 50 microns or so, they're going to end up settling on some surface and contaminating that surface indoors. You get to smaller particles, they're going to largely stay suspended until they're exhausted to the outdoor environment. It is possible for them to deposit on surfaces, mostly not by gravitational settling. There are other mechanisms for removal of small particles. If they get really close to an indoor surface, they can be removed by some of these other mechanisms we call interception and et cetera. And so maybe on the order of 5% or 10% of even the small particles in an indoor environment, the really tiny particles, will deposit on surfaces, and the remainder, on the order of 90%, will be exhausted to the outdoor environment. But when those small particles are deposited on indoor surfaces, it's not necessarily near the infector, which is more of the case for larger particles or droplets. So the small particles can migrate very far. They might even migrate to another room and deposit on a surface in another room. They stay suspended a long time.
Dr. Corsi, can you tell us about the various different strategies that we could all use to reduce the risk of exposure to the SARS-CoV-2 virus in our offices and schools and whatever other buildings we might be in, our churches, for example?
Yeah, so this is something that many of us have been stressing for some time, this concept of layered risk reduction strategies or layered risk reduction interventions. It all starts with the source. There's a famous quote in the indoor air quality field by one of the acknowledges sort of the father of the indoor air quality field, somebody named Max von Pettenkofer. And he had a quote that said, if you walk into a room and there's a huge pile of manure in the middle of the room, the solution is not to ventilate. The solution is to remove the pile of manure, right? And that is getting to the core of what we try to do in indoor air sciences, which is remove sources that are bad from buildings. Get the source out, and then you don't have to worry about ventilation or engineering controls. So the way we deal with the source in terms of spread of COVID-19 is to test to the extent that we can to make sure that people who are sick don't enter buildings. De-densify. If you can reduce the number of workers at work by 50%, you've reduced the probability that there's an infector in the space by 50%. The more people that can work at home, the better. There are certain activities that generate a lot of aerosols, singing, aerobic exercise if somebody's breathing really heavily, a lot of speaking, debate, those kinds of things are going to be generate more particles. There are certain surfaces where resuspension, meaning particles that have deposited on surfaces, can come back off those surfaces. If any particles are deposited on the floor, we know that if people are walking on the floor, just by compressing their foot on the floor or dragging their foot on the floor, you can resuspend a cloud of particles that may contain SARS-CoV-2 viruses in them. So my team has done research in a 4-year study of high schools in Central Texas, and we find that when students come into classrooms, leave classrooms, or engage in certain activities in the classroom, there are these big clouds of particles that are resuspended into the room and literally can double, triple, quadruple the levels of particle concentrations in the room. And then wearing masks is really important, especially if it's universal. If everybody wears a mask, then the infector's got a mask on. And so when they're speaking or breathing or whatever they're doing, it's singing, hopefully not, that reduces the amount of particles that come out of their respiratory system into the room. So that's source control. Physical distancing is really important, even when people wearing masks. Timing, reducing the amount of time that people spend in environments with lots of other people. Changing the sequencing, for example, in schools of class periods when they get out, so that you don't have everybody in the hallway at the same time. My university, we're actually leaving an entire class period between class meetings, which gives an opportunity for any particles that are in the air to be removed to the outdoor environment. So decay in particles in the air, but also reduces the contact between students. Besides all of that, then we get to engineering controls. And I consider ventilation to be an engineering control if you're going to do it right, as well as filtration, UV irradiation, portable air cleaners. And finally, I think the other thing I've noticed is the importance of continuously reminding people that we're in a really dangerous situation. And so I've suggested at my own university that every single class period start with a reminder to everybody of what we need to do to stay safe, to help one another. And I think the same thing should be done in offices. I think bosses should remind their employees every single day that we're in this very dangerous situation and we have to take the following steps to keep each other safe. So education is also very important.
Dr. Corsi, you mentioned ventilation, number one, and you've also described the problem of energy efficiency, because during the 80s and 90s and even into 2000, 2010, everybody was really focused on efficiency. And buildings were made very tight, and we didn't necessarily bring in a lot of outside air. What would be an ideal ventilation system for the 21st century, not just to reduce our risk of coming down with COVID-19, but also influenza and lots of other infections that are out there? What would your ideal ventilation system be?
Yeah. So the first thing I'll say is tight is not necessarily bad. So if you don't have a tight building envelope, the air is going to come in through all sorts of places you don't necessarily want it to come in from, right? And my team's even found that sometimes if you have a tight building envelope and you have negative ventilation, you get, if you don't have that tight of a building envelope and you have negative ventilation, you get air coming in through wall cavities that are filled with formaldehyde from oriented strand board or other pressed wood products. And you can actually make your problem worse even by, ventilating. So what you want to do is have a tight envelope, but then you also at the same time want to have a design air intake, right? We want to make sure that we bring air in. We want to know where we're bringing the air in from, and we want to be able to design the system so that it brings in a proper amount of air. So energy recovery ventilation systems can do that. We don't have a lot of those on homes in the United States. We don't have many of them on schools in the United States. But if we're looking at residential buildings, I think that it's tight with a design air intake. Schools are a big problem in this sense. I've probably done more monitoring in schools and worked with schools than any other building environment. And I find, really large fraction, over 50% certainly, of classrooms are severely underventilated. And in working with poorer school districts that serve the underserved largely in places like the Rio Grande Valley in Texas, basically the underventilation classrooms is on purpose, and it's to conserve energy so that the school district doesn't have to pay the energy bills. And what you have is a situation where just generally that's not a good idea. We know that odors accumulate, nuisance compounds accumulate, and even toxic things can accumulate in classrooms when you underventilate them. And now we have a situation where we're worried about the SARS-CoV-2 virus in classrooms, and in underventilated, poorly ventilated classrooms, this is a big, big issue. We need to have design air intakes so that we can actually control the amount of outdoor air that comes in. And to do that, you do actually want to have a tight envelope, a tight building envelope, but with a location in the building or locations in the building where you are bringing air in through a specific location where you know the air is coming in.
Dr. Corsi, you mentioned air filtration. And I remember back when filters looked, as one air expert described them, butterfly nets. They weren't good for much of anything other than very large dust particles. What kind of air filtration do you recommend in the age of COVID-19?
So for centralized systems, I would recommend MERV 13, MERV 13, or higher filters if your system can handle those. MERV 13 filters will effectively remove, if they're seated properly, almost all of the particles that are of the size that we believe tend to be the most virus-laden particles. So MERV 13 filters, and if you're using a portable air cleaner, it would be a HEPA-based portable air cleaner. Those two filters will remove almost all of the particles that go through them that are of the size of relevance to this coronavirus.
Dr. Corsi, you mentioned MERV 13. What does that mean, and how would someone find such a filter?
So MERV stands for Minimum Efficiency Removal Volume. And typically people in their homes might have a MERV 7, MERV 8 filter, which are not very good at removing the particles of the size that we want to remove to protect us from transmission and infection by the coronavirus. You can go online. There are some filter manufacturers that actually list the MERV ratings. There are some that don't, that use their own ratings, and sometimes it's hard to map those. But you want to, in those cases where a MERV rating is not specified for a filter, you want to look for filters that have good data for removal of smoke particles. If you can find filters that have very high effectiveness for removal of smoke particles, that's kind of what you want to aim for. The butterfly net example that was given previously, those are good for moving cat fur and cat hair and big particles, or dust particles or pollen particles, but not effective for the size of particles that we want to remove in this pandemic.
Now, Dr. Corsi, some people are going to be looking for portable air cleaners because there isn't much they can do about the HVAC system in their apartment building, for example. What should they be looking for?
So you want to, first of all, look for a HEPA-based, HEPA, portable air cleaner. That's the proven technology. It works. You don't need anything else on the HEPA-based portable air cleaner. Some companies are selling all sorts of add-ons and gadgets that don't really do much. And so there's really not a need to purchase an air cleaner that has all those additional add-ons. So a HEPA-based portable air cleaner that has as high of what's called a clean air delivery rate, a CADR, as possible. So in the example that you gave, a small apartment, a clean air delivery rate of 300 or better would be good. It's important to understand what those units are because sometimes the manufacturer doesn't tell you what the units are, but the units are cubic feet per minute. So if you see the number 300, that should mean cubic feet per minute. I caution that there's a couple of companies now that are giving clean air delivery rates in units of meters cubed per hour, which if you converted them to cubic feet per minute would be much lower. So make sure you understand what the units are that you're working with. Something that has a clean air delivery rate of 300 cubic feet per minute or higher is going to remove a lot of particles from air in a small apartment or, say, in a classroom in an elementary school. The clean air delivery rate is a concept that many people don't understand. It's pretty simple. It's the multiplication of two numbers. The first number is what we call the fractional removal efficiency of the particles that go through the system. So if you have a bunch of particles that move through a box, this portable air cleaner, that first number is the fraction of those particles that are actually removed. So the highest number can be 1. That means that every particle that went through the device was removed. If it's 0.5, only 50% of the particles that went through the device are removed. You multiply that number, that fractional removal efficiency, by the actual volumetric flow rate of air through the device. So cubic feet per minute or meter cubed per hour, that type of thing. There are some devices where that first number is very high. So it looks like they're very good at removing particles that go through them. The problem is the second number is really low. There's very little flow through the device. And so its effectiveness, its clean air delivery rate tends to be very low. And that's true of a lot of, I don't know if you remember 10, 15 years ago, there were a lot of people buying these standalone ion generators or ionic air cleaners. They tend to have a very high particle removal efficiency, but an extremely low flow rate through them. So they were relatively, very ineffective compared with a HEPA-based portable air cleaner.
Dr. Corsi, you also mentioned ultraviolet air purification. That sounds a lot like the sun. So can you explain a little bit how UV purification works? Can you put it in your HVAC system so that there are ultraviolet lights in the ductwork? Or what is the standard way of doing this, for example, in a hospital room?
Mm-hmm. So the two main ways that UV radiation is used is either in ductwork, so it's in the mechanical system, where it's safe in that people are not going to be staring into the ducts, and can be, if done right, can be very effective at inactivating viruses that are being carried by particles. The second way is upper room irradiation. So this would be a system that's above everybody's heads. You obviously have to be very careful when you do that. You don't want the UV radiation hitting people's skins or people being able to look directly into it and hurting their eyes. So one way of doing that with upper room irradiation is to put a false ceiling in and create an airflow pattern so that the air from the room flows above the false ceiling, goes through the irradiation zone, and then comes back out into the room. I know that that's being done in a couple of places that I'm aware of in the United States right now with false ceilings. The tricky thing with UV is that it has to be done right. The lamp has to be such that you're not generating a lot of ozone in the process, and most systems that are good systems won't. And there are less people that are experts on UV radiation than, say, there are contractors around the country who understand filters. Filter technology is something that there are a lot of people that work in that field that can help businesses and can help school districts and can even help individuals in residential housing. That's not true for UV. It's harder to find people that are real experts that can make sure that it's done right. If it's done right, it can be extremely effective at inactivating viruses in air.
Dr. Corsi, if a family member gets sick and needs to be isolated from the rest of the family at home, what would you recommend?
It's important that that person be isolated. So I would create an isolation zone under negative pressure. Find a place in the home where that individual can stay in a room, hopefully with their own bathroom if possible, and take a box fan, put a box fan in a window in the room where the person who's infected is staying, and point that box fan out so that the air is blowing out the window to the outdoors. That'll create a negative pressure zone where the individual who's infected is, and it'll minimize the amount of air that's in their room that gets back into the rest of the house. If it's possible, turning off the air conditioning system so that air is not returned from, if there are return ducts, the air is not returned from the isolation zone to the rest of the house. And then it would also help to have portable air cleaners in the other portions of the house, and maybe even in the isolation zone to keep the levels of particles low in the isolation zone, just in case there is a little bit of feedback from the isolation zone back into the rest of the house. My wife and I actually have drawn up plans for doing this in our own house. If one of us gets sick, we have plans for how we're going to put it under negative pressure and how we're going to operate our AC and how we're going to operate our portable air cleaners and how we're going to get food to the individual who's sick. So I think it's good for families to think about that. But box fans are cheap. $25, you get a good box fan. Just keep it on continuously blowing out the window.
Great idea, which had not occurred to me. I'm sure that there are a lot of other things that have not occurred to me. Dr. Corsi, you teach at Portland State University. Has your university consulted you to try to reduce the risks of COVID-19 transmission on campus? And if so, what is it doing?
Yeah, thank you for asking. The answer is yes. So we have 2 committees on campus, about 40 total people that have been working on this. And I'm proud of the fact that we started early. I think it was April we started planning for the fall term. One committee is focused on more of the technology side of things. The other committee is focused on the administrative side of things to reduce exposures and just keep the campus safe. So we are doing a number of things. The first thing we're doing is de-densifying the campus. So we have a lot of remote courses in the fall term. We have a few hybrid courses and some face-to-face courses, but we are thinning out campus as much as possible. We are keeping services open for students like our health center and all those things. And there are going to be classes on campus, but not nearly the density of classes that we would normally have. We have a mask requirement for all buildings on campus, and that's for everybody. Faculty, staff, and students have to wear masks at all times. And we're tying that to the code of conduct of the university. If you're not wearing a mask, then you're putting other people's lives in danger. And so that's a breach of the code of conduct of the university. So we're putting teeth behind the mask wearing. We've changed class timing so that, as I said, we're going to have one empty class period between every class meeting. So if you have a 1-hour class, as soon as your class leaves, no other class comes in for at least an hour. And that gives time for any aerosols, any particles that are in the air from the previous class to essentially decay down to almost nothing. And it also means that we reduce the amount of mingling of students or, students in close contact in hallways. We are designing all of our classrooms for physical distancing as well. So at least 6 feet physical distancing with everybody wearing masks. We're increasing the ventilation in some of our buildings. We already have pretty high outdoor air supply rates. So increasing for us is not as important as it is for others. Portland, Oregon is not Houston, Texas. And about 80 to 90% of our buildings, we're replacing all of our MERV 8 filters with MERV 13 filters. The buildings for which we can't do that because the system just can't handle MERV 13 filters, we're essentially taking offline. We're saying we're not going to have classes in those buildings. And we've purchased a whole army of portable air cleaners that we'll use in some of the smaller classrooms, less than 1,000 square feet. So really, really significant amount of layered risk reduction. And I'm pretty confident that our campus anyway, will be as safe as it possibly can be. There's always concerns. We're an urban campus downtown, so a lot of students take mass transit to come to campus, and that's probably where their highest risk is going to be. I think about 65% of our students take buses and light rail to come to campus.
Dr. Corsi, you've looked at portable air filters. I wonder if you could share with our listeners some of the brands or products that you think are most effective.
So I try very hard not to mention any brands or products. I purchased a whole bunch for the building I'm at Portland State University, and I've always felt it's unfair for somebody like me to actually say, this is the product I'm purchasing, because it's a bit of an endorsement. There are a lot of good products on the market. What they have in common is that they have a clean air delivery rate that's 300 standard cubic feet per minute or higher. And you can actually Google just portable air cleaners, HEPA, and you'll find all sorts of information. Make sure you look for a clean air delivery rate that's 300 standard cubic feet or higher for something like a standard classroom or a bedroom. I've actually tested a lot of these in my own lab. I was at the University of Texas for 25 years and had a wonderful laboratory there before coming to Portland State University. I've tested a lot. I've tested in the lab. I've actually brought them home to my own home and tested in my own home to see how effective they are at reducing particle levels in my bedroom versus the living room, et cetera. And for 300 standard cubic feet per minute or above, you're going to get, if it's the right size room, 50 to 70% removal of particles in air.
Great. Dr. Coursey, we often have to go out into the environment, the bank, the supermarket. Maybe we have to get on a bus or a public transportation of some sort, a subway. And I'd like to know what your recommendations are when we go out in public. If we have to go into a bank, if we have to go into somebody's office, if, for example, we stop over and have lunch in a restaurant, what should we be looking out for? How do we protect ourselves, especially since we really can't inspect their ventilation system to find out if it's safe?
Right. Yeah, you want to make sure there's good physical distancing in any environment you go into. You want to make sure that people in that environment are wearing a mask, and you certainly should be wearing a mask. And you want to spend as little time in those environments as possible. My wife and I are not going out to eat at restaurants right now. If we did, we would be eating outdoors, only at restaurants that had outdoor seating that had good physical distancing, even outdoors. So a lot of the restaurants we see in Portland, Oregon, do have outdoor seating, but they're cramped together. There's not enough physical distancing for us. We have done takeout where we go to a restaurant and we get things and we bring it home, or we go to a park and eat it in the park so that we're away from everybody. But I think the answer really is go into environments where there's good physical distancing, where everybody is required to wear a mask, and stay in that environment for as little time as possible.
What about when we go outside? We go walking in the woods, and a lot of times there are people out in front of us walking. Sometimes a group of runners goes scooting by, and we're sort of in their wake. Some people go bike riding, and they are following somebody, and there's this concern that maybe you're breathing their air. And finally, what about places like elevators? You've talked about you shouldn't talk on elevators. So give us a sense of getting around outside and sometimes in buildings with elevators.
So I'll start first with the walking and hiking and bike riding kind of things. The risks outdoors are going to be much, much lower than indoors, but there's still a risk. The outdoor atmosphere does a pretty good job of mixing things away from the source. So reducing the sort of level of particles that you're going to breathe if you're in the wake of somebody. I walk in my neighborhood and I have people riding their bikes by me all the time from behind me. And sometimes they get really close to me. And a lot of times they're not wearing masks. And I only put my mask on when I see that I'm coming up to a group. So I carry my mask with me. I do 90-minute walks every night. I carry my mask with me. And if I'm coming up with a family that's walking towards me or something, I'll put my mask on. Try to maintain as good a physical distancing as possible. But the risks are low. Keeping the risk low is important to me, and it should be to everybody. So being outdoors, generally the risk is going to be low, but I still carry a mask with me just in case I'm crossing somebody on a trail or a family's walking towards me, or that kind of thing. For elevators, that's become a huge issue. A lot of people have angst about riding in elevators. It turns out that elevators are pretty well ventilated. I've learned a lot about elevators in the last 6 months because I've been asked so much about it. And it turns out that elevators generally are very well ventilated. You spend very little time generally in an elevator when you're riding in an elevator. And so, aerosols are not going to really accumulate to high levels in an elevator cabin. If you get into an elevator that somebody else had ridden that was infected, chances are the levels of viruses are extremely low in that elevator when you get into it. There's still a risk because there's probably still some virus-laden particles there, but it's very, very low. The biggest concern on elevators is if you're standing right next to somebody and they're breathing right on you or they're speaking right at you. It's that very close contact, because in an elevator, that contact can be very, very close. And even if the elevator is well ventilated, you might be getting a spray of large droplets and even these very small, tiny aerosols that you're inhaling. So the elevator etiquette that I suggest is that, A, there should be no speaking on elevators, because speaking generates 10 times or more of the levels of particles coming out of somebody's mouth than simply from breathing. So no speaking on elevators. Turn your back to everybody in the elevator. My suggestion is no more than 3 or 4 people in an elevator at a time, which I know is tough in some big office buildings in New York City. But in other places, it's not that hard. Face the corner, face away from everybody. Nobody speak. Everybody should be required to wear a mask.
Dr. Corsi, in your overview of what people should be doing to reduce their risk of catching COVID-19, what would you suggest? What are your recommendations?
As an individual, I think it's really important to reduce your contact with sources. And unfortunately, that means a little bit of loneliness for all of us right now, right? So we can't do all the things we wanted to do. So my wife and I don't go out to restaurants anymore. We minimize the amount of time that we're in a grocery store if we go in a grocery store or to the bank or whatever. Spend as much time outdoors while you can. I know it's difficult in the wintertime in parts of the country and in the summertime in other parts of the country, but spend as much time outdoors as you can with your family. Go camping with your family. That's a great activity. Just stay away from crowds and always wear a mask. Always wear a mask if you go into any building that's not your own home. And you should be cautious of going into any building, even when you're wearing a mask, if other people are not wearing masks.
So, Dr. Corsi, it sounds like there are a lot of things that we can do to reduce our risks: ventilation, filtration, ultraviolet, and portable air purifiers. Thank you so much for talking with us on the People's Pharmacy today.
It's my pleasure. Thank you so much.
You've been listening to Dr. Richard Corsi, Dean of the Massey College of Engineering and Computer Science at Portland State University in Oregon. Prior to his current position, Dr. Corsi spent 25 years as a faculty member, department chair, and endowed research chair at the University of Texas at Austin. There, he did extensive research related to sources, fate, human exposure to, and control of a wide range of indoor air pollutants. He's currently president of the Academy of Fellows of the International Society of Indoor Air Quality and Research.
After the break, we'll talk with Dr. Lindsay Marr of Virginia Tech. She's one of the leading experts on how viruses spread through aerosols.
Dr. Marr will describe exactly how particle size affects how long viruses can stay in the air and how far they can travel.
We'll explore the pros and cons of masks.
How can we deal safely with indoor spaces that don't have perfect ventilation?
Dr. Marr will offer advice on how to stay healthy during the pandemic.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This People's Pharmacy podcast is brought to you in part by Verisana.com.
Verisana Lab offers home health tests that allow you to monitor your hormones and health conditions. You can take control of the quantitative assessment of your health and learn about male and female hormone balance, the stress hormone cortisol, leaky gut, gluten intolerance, or your gut microbiome.
Take a more active role in tracking your health and take 20% off your first order of a mail-in testing opportunity with the discount code PEOPLE. That's uppercase PEOPLE. To learn more, go to Verisana.com. That's VERISANA.com. Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by CocoVia Memory Plus, a supplement with 750 milligrams of cocoflavanols, the plant-based nutrients from fresh cocoa that help support memory. More information at cocovia.com.
Also by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
Our next guest is one of the world's foremost authorities on airborne viral transmission.
Dr. Lindsay Marr is a professor of civil and environmental engineering at Virginia Tech, where she leads the Applied Interdisciplinary Research in Air Laboratory. Her research group focuses on three main areas: air pollution, the dynamics of biological aerosols like viruses, bacteria, and fungi, and the characteristics of the tiniest of natural and man-made particles called nanomaterials.
Dr. Lindsay Marr, you're one of a handful of scientists studying aerosol transmission of viruses. We are so honored to have you with us today on the People's Pharmacy. Thank you for taking time out of your really busy schedule to join us.
It's great to be here with you today.
Dr. Marr, as Joe just pointed out, there are very few scientists who have followed your path of research, and almost none of us in the non-scientific community were interested in viruses and aerosols and how they move through the air before this pandemic struck. How did you get interested in that? I understand it has something to do with a daycare center.
Yes, I had my first child 12 and a half years ago, and he started daycare, and he got sick so frequently that it was very frustrating to me and my spouse, because we'd get the phone call at work and telling us that he was sick. We'd have to come pick him up. This happened every other week on average. And when I went to pick him up, sometimes I'd find out that more than half the kids were out at the same time with the same symptoms. And it just seemed to me, and I know this daycare center was very good about hygiene, hand washing, and cleaning toys and surfaces. And so it seemed, I started wondering if whatever bacteria or virus they were passing around was going through the air.
And where did that lead you?
I started looking into the scientific literature, reading papers to try to figure out what we knew about this. And I was surprised to learn that even for the flu, which we've studied for 100 years, we don't know how much of it is transmitted by touching contaminated objects or shaking hands or through the air. And that was really surprising to me. I also found that the way that transmission through the air was being described in these papers was just physically incorrect compared with what we know about how droplets and microscopic droplets that we call aerosols travel through the air.
Well, could you explain that, please?
Yeah, the traditional definition of transmission through the air says that it involves what we call aerosols or microscopic droplets that are smaller than 5 microns. So for comparison, a human hair is maybe 50 to 70 microns in diameter. And they said that anything larger than that cutoff, larger than 5 microns, flew through the air and could land on someone's eyes, nose, or mouth, and that's how it would be transmitted. But I knew that 5 microns was really so small that it could stay floating in the air for half an hour or more, and it wasn't really large enough to fly through the air the way they described it. And it wasn't just a small error. The error is like a factor of 10. So there was this disagreement between what they talked about in terms of size and how it was moving between people.
Well, you've described it as the difference between Windex, in other words, spraying Windex on a window, versus smoke or a fog machine.
Yeah.
So tell us how that would impact how far and how long particles might stay in the air.
Right. Thanks for reminding me of that. So if you take a spray bottle like Windex and you spray it on your glass, that's like these large droplets that we're talking about that could, if you're close to someone, they can fly through the air and hit someone's eyes, nose, or lips. But at the same time that you are that you have these large Windex type droplets coming out, for every one of those, there's at least 100 more microscopic ones that we can see from a fog machine or cigarette smoke when there's enough of them. And those behave very differently, of course. If you blow your cigarette smoke at that same glass, you know that those cigarette smoke particles aren't all just going to stick to the glass. They're going to kind of move towards the glass, and then it will spread out and follow the airflow as it hits the glass and then moves to the side.
There was some research recently published from the University of Florida that was really quite extraordinary, and you've described it as the smoking gun of aerosol transmission. Can you tell us why that was so important?
Yes, one of the biggest questions that people have had about, especially those who doubt that transmission by aerosols is important, is they say, well, we have not found infectious virus in the air. And that has been largely true because the way that we have to sample air is we almost use a big vacuum cleaner and we pull air through basically a vacuum bag. We call it a filter, and the large things kind of stick on that filter. The problem is when you're doing that, the virus may stick to that filter, and then in the meantime, you're pulling all this air through there. And some of these viruses are fairly fragile, and they fall apart or they decay when that's happening. And so the Florida group has spent several years developing an instrument that can sample in a much gentler way. And what it does is it pulls the aerosols into it, it condenses water onto them, and then it puts them straight into a liquid. So the viruses are never sitting there on a dry surface being exposed to lots of air blowing past for hours during the minutes or hours during the sampling period. And so this has been a real breakthrough. They've used this to show flu virus in air, and now they've used it to show that SARS coronavirus 2 is in aerosols, more than 6 feet away from patients' beds, is infectious. And so there's one more step here, which is, can you breathe in enough of it in order to cause you to get sick, to initiate infection? That we can't actually test in a laboratory study with human subjects because it's unethical. We can't purposely expose them to these aerosols. But there are animal studies that indicate this, and we know from other viruses that if you breathe enough of them, it's going to cause you to get sick.
Well, as you mentioned, the Florida study demonstrated that you can pick up viable virus particles more than 6 feet away. What are the implications?
The implications of this are that we should be wearing masks. Everyone should be wearing masks when they're indoors at all times, covering their noses and mouth. And that should be in a distance to the distancing of 6 feet. So 6 feet is a good guideline. It keeps you away from people's droplets from their Windex spray, and it keeps you away from the most concentrated part of the mouth mist, or the most concentrated part of that cigarette plume, if you want to think about it that way. But once you get beyond 6 feet, that cigarette smoke doesn't stop at 6 feet. It can float in the air for a long period of time, and it can kind of spread throughout the room. It becomes more diluted. But if the smoker's wearing a mask and you're wearing a mask, well, then there's going to be less smoke getting into the air, and your mask will block at least some of those smoke particles keep you from breathing them in.
Let's talk about masks, because as with almost everything nowadays, the question of masks has become extremely polarized. And there are people who say masks, they don't really work, because some air escapes around the edges, some air gets through. And tell us, what does the research actually say about masks, and which masks are most appropriate?
It is correct that those critiques are correct in that if there are gaps in the mask, things can flow in through the sides. Cloth masks are not as good as an N95 respirator at stopping certain size aerosols, but cloth masks are certainly better than nothing. We've been looking at masks, and other people have been looking at cloth masks. And although they're not great at stopping the size of aerosols that N95s can, these cloth masks are actually pretty good at stopping things just a little bit larger. And though we think that those just a little bit larger aerosols are actually maybe even more important for transmitting the virus through the air. And so, we see that cloth masks can stop, 50% of kind of the medium-sized aerosols. And once you get up to the larger ones, they're blocking 80 or 90% of them. And that's almost all types of materials. You get a lot of benefit by going to 2 layers, a huge benefit. I would strongly recommend 2 layers or more for everyone. And then fit is also a key. So even if you have a great material, if it's too stiff and it doesn't fit well to your face and you have gaps, well, then you're going to have short circuiting. And I do want to add that, yes, even though it's only 50 or 80%, it's not 95%. I would say that 50 to 80% is a lot better than nothing.
Dr. Marr, the University of Florida study that you mentioned was done in hospital rooms, and they had really great ventilation, they had effective filtration, and they even had UV air purification. Most of us don't have the luxury of that kind of exposure. I'm wondering about the spaces that we go into. I'm thinking about a case where a woman caught COVID-19 in the bathroom of an airplane because she took her mask off while she was in that bathroom. I'm thinking about other small spaces where there may be poor ventilation. Can you give us some insight on our behavior in places where ventilation may not be great?
Well, the first thing to do would be to avoid them. The second thing is, if you have any control over it, open doors or windows to try to improve the ventilation, or talk with the person who's in charge of that to see if they can do anything to improve the ventilation with outdoor air, not just recirculating it more. But another thing you can do is to upgrade filters that might be in the system that would increase your ability to remove virus from the air.
Now, when you walk into a room, where someone has been who actually is infected, are you walking into probably an invisible cloud of virus? Is that a problem? And what about outside? If you are walking around outside and you get a little closer than 6 feet to someone, is that a problem?
So inside, if someone's been there and they're gone, yes, when they were breathing, there was a cloud or kind of a plume, near their mouth. But if they've been gone for a minute or so, that spreads out and becomes much more diluted in the room air. And so I don't think of it as if the person's not there, I don't think of it as walking through a cloud. I think of it as walking into a room where someone was smoking and the smoke has kind of spread and diluted throughout the room. And so the question is, how good is the ventilation so that you can clear that out of the air? Outside, if you pass by someone less than 6 feet, the chances, I think, from what we have seen so far, the chances of becoming infected are very low. There's no indication that this happens over these brief encounters. It really seems to take a bit of exposure, like a conversation with that person at close distance. But if you're in a crowded area and you're continuously passing by, 100,000 people at close distance, then that could add up. And I would say, everyone should be wearing masks in that case.
What role does humidity play in the behavior of these airborne particles? Do we know?
We often hear that people catch the flu or colds more often in the winter when the air perhaps is a lot drier than it is during the summer. Does that have an impact?
Yes, we think that does have an impact for flu. We don't know yet for COVID-19 whether there will be a seasonal effect. It's kind of different because with flu, there's a lot of pre-existing immunity among the population. We have flus, going around every year. With the new coronavirus, of course, it's novel. Nobody has any immunity to it, so it's a little bit different. But I can say that for the flu, we think that the wintertime seasonality is related to one of 2 factors. First of all, we know that the virus survives better under dry humidity, actually, which seems counterintuitive. But, indoors, in the wintertime, we heat our air. That brings the humidity down below 40%, and the virus can survive much better under those conditions. Now, the coronavirus is of a similar type to influenza, and that has this we call it an envelope or a little shell around it that makes it a little bit similar. And so it might also survive well under dry conditions. The other factor is that our immune response seems to be weaker when it's less humid. That's been shown at least in animals and with the flu. Now, for the coronavirus, again, I don't know if the survival of the virus at, better survival at dry conditions is going to make a difference, because it seems to survive really well under all conditions from what we've seen in laboratory studies so far.
Dr. Marr, what advice do you have for our listeners to try to stay healthy as we face down the rest of this pandemic, which hopefully won't last forever?
No, I'm looking forward to this will end, and it will end sooner if we can get community transmission down. The things that are important for doing that are distancing, as we've talked about, masks at all times indoors, worn by everyone, covering the nose and mouth, avoiding crowds, and paying attention to good ventilation indoors, whether that's opening windows or switching your system to more outdoor air and upgrading filters. And then, of course, I don't want to forget washing hands and cleaning surfaces can also break that chain of transmission.
And that is all within our power.
Yes, there are things we can do. I know that, we hear about airborne transmission and think this might be scary, but these things that we've talked about are all known to be effective. They will greatly reduce the risk of transmission. All the big outbreaks that we've seen so far involve situations where people weren't wearing masks, it was crowded, or the ventilation was poor. But we really haven't seen outbreaks when people are paying attention to those 5 things that I mentioned.
Dr. Lindsay Marr, thank you so very much for talking with us on the People's Pharmacy today.
It's been a pleasure. Thank you very much for having me.
You've been listening to Dr. Lindsay Marr. She's a professor of civil and environmental engineering at Virginia Tech, where she leads the Applied Interdisciplinary Research in Air Laboratory. Her research group focuses on 3 main areas: how air inside buildings and outside in the natural environment affects, transports, and interacts with pollution, the dynamics of biological aerosols like viruses, bacteria, and fungi, and the characteristics of the tiniest of natural and man-made particles called nanomaterials.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composes our theme music.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy is brought to you in part by Verazana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
And by CocoVia Memory Plus, a cocoflavanol supplement backed by 4 clinical studies that show significant improvement in 3 different aspects of memory. More information at cocovia.com.
To buy a CD of today's show or any other People's Pharmacy episode, you can call 800-732-2334. Today's show is number 1227. The number again, 800-732-2334, online at peoplespharmacy.com.
When you visit the website, you can share your thoughts about today's show. You can subscribe to the podcast through Apple, Stitcher, Google, or your favorite podcast provider. It's posted on our website every Monday morning.
At our website, you can sign up for our free online newsletter to get the latest news about COVID-19 and other important health stories. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.